Welcome to Lyme Time. I'm Allie from the Tick Chicks. We are all more than Lyme disease and chronic illness, and together we stand with you to overcome and rise. I'll bring you closer to the experts in cutting-edge treatments and even a few unexpected ways of healing. I'll ask the questions you want answers to regarding Lyme disease and successful ways of getting you closer to 100%. We are in this together and will not be defined by Lyme. Today, I am thrilled to be with my guest, Dr. David Traster. And Dr. Traster is a globally recognized expert in the field of neurological rehabilitation, which is so important to all of us. He lectures and consults for doctors of all specialties across the world relating to patients with a variety of neurological disorders. Due to his clinical success, patients travel from around the world to work with Dr. Traster during his 1 or 2 week intensive outpatient rehabilitation programs. Dr. Traster was personally mentored as a student by the world-renowned Dr. Frederick Carrick. Dr. Traster is currently an assistant professor for the Carrick Institute and leads their vestibular rehabilitation program, as well as lecturing on other topics. Dr. Traster was named Instructor of the Year by the Carrick Institute in 2018, and he has also had over 45 peer-reviewed case studies published in mainstream neurology medical journals. Dr. Traster holds the highest level of education in functional neurology by attaining his diploma in chiropractic neurology and functional neurology. So welcome, Dr. Traster.
Thank you for having me. And one point that I don't think you mentioned.
Yes.
I had Lyme disease.
Well, that was my next question. I was going to ask you about your journey and sort of what led you to where you are right now.
Absolutely. So I always tell people when it comes to my journey, I'm very biased because it's my journey, right? So I can only tell you what happened to me, how I perceive it, and my experience, right? Just like everyone else has their own experience, because Lyme disease, I don't even like calling it Lyme disease sometimes because it almost makes it seem like it's one thing, and as we know, there's so many co-infections that might give you more symptoms than the actual spirochete, So, a lot of times we'll say tick-borne infections. And even that I don't love using because we don't even know if it's really, is the tick the only vector, right? We think so, right? But, obviously there's research looking at other aspects. It's controversial to some people, but it's really, Lyme disease is difficult. It's difficult to be diagnosed correctly. It's difficult to know what treatment's correct, right? And so my experience was, I was a pretty good athlete. I had shoulder surgery when I was 17, and I woke up from shoulder surgery just feeling different. Didn't know why. I'm from North Jersey. I went to summer camps and playing basketball in the Berkshires in Massachusetts, so I lived and I've been around all the top areas, of where ticks are and where Lyme disease is. Have I ever seen a tick on me? No, but I'm the type of person, especially as a kid, I wouldn't even recognize it, so I can't tell you whether I was bit by a tick or not, maybe. What I can tell you is I got chronically ill right away after surgery at 17, and I was misdiagnosed until 26. And about 26 is when I finally got a Lyme diagnosis. But, a lot of it for me, the most notable symptoms for me were digestive symptoms, where I all of a sudden became sensitive to all foods. I was bloated all the time. I started getting boils and carbuncles and all types of skin issues, and I had no energy. I went from being a Division I prospect playing basketball to can't get out of bed. And I went like most people do. My dad's a pharmacist. I came from a very mainstream environment. And I went to every doctor you could think of, the top hospitals, the top doctors. And, the top people, the good people said they didn't know. The people who I think weren't as good blamed it on me, right? It must be in my head. My parents were, not my parents at the time were considering putting me in a psychiatric ward because maybe I was just depressed. Maybe, it just, no one could figure it out. I went through my senior year in high school, all through college, and most of my 20s going to bed being like, am I going to live, right? I didn't know. I knew I felt terrible. I didn't know what was wrong with me. I didn't know what was going to happen. Finally, around 26, a family friend said, hey, go look at this medical doctor. And her name is Dr. Gidroic. She's in Morristown, New Jersey. She's very big in the ILADS world. And at the time, this is probably, I don't know, 2008-ish, right? And so she was the first person to diagnose me and diagnosed me with Lyme, and said, I can't tell you this is causing everything, but this seems to be significant. And at the time, I don't know if she was earlier on in the process. She was trained by Dr. Weil, and she did really good credentials, but she actually referred me to a doctor named Dr. Raxlin in Manhattan, who's like one of the earlier ILAD doctors. I'm not sure if he's still practicing, but he was in the upper West Side, I think, somewhere in Manhattan, uptown. And that was the beginning of my Lyme journey. And my Lyme journey, again, we go more detail, but my Lyme journey started with oral medication. It transitioned to oral and IV medication with IV vitamin C. It then transitioned into my PICC line, kept getting infected. And, I started getting into septic shocks. Then I had to get PICC lines to treat the PICC lines, and then eventually after the second time that happened, it was like, it almost killed me twice. And so finally I was like, I can't keep doing this. This is just, I got to change something. I didn't know what it was, but, some of the medication did help. Some of the medication, I don't know if it helped, right? But there were certain medications, like for me, IV Flagyl was a lifesaver, but I couldn't be on it long enough because I kept getting infected with the PICC line, And so there's certain medications where I could say for me, it definitely helped. And certain like Rocephin I took, I don't know if it helped or not. It didn't feel a difference, right? And so maybe it did, maybe it didn't. But eventually I just couldn't take the medication anymore. At the time, I was a personal trainer in New York City because I knew how to train. I just couldn't do it, and I didn't know what I was going to do in my life because it was just difficult living, right? And I had a client who said, look, I've been sick for really long. There's a chiropractor I know in New Jersey. He does this weird German homeopathy, German medicine thing. I don't know what he is. I don't know what he does. He's a little crazy, but he helped me a lot, right? And, I don't know, maybe around 4 months later, 5 months later, finally I was at the wall. I said, I got to try something. So having never been to a chiropractor, not believing it at all, because if it worked, why isn't everyone going, right? And so having my own personal bias prevented me from expanding my thoughts outside the medical industry for about 9 years, right? Yeah. Just my own psychology, my own in training of how the world works, just how psychology works. I was very closed-minded to things. I thought I knew everything, right? Or I thought I knew enough where, I was going to dictate my own path. But eventually I ran out of options, I had no options. So I saw this chiropractor. I went in saying, if he says anything weird, anything strange, I'm walking out. I'm not going to give him a dime, right? Like, I'm not doing anything. And I went in, I didn't tell him anything. I didn't really do a history. I said, I'm not going to tell this guy anything. Let's see what he figures out. And the guy was amazing. This guy named Andy Patak down in New Jersey. He's got a place called the Body Scan, New Jersey. He does EAV machines. He does muscle testing. He does homeopathy. He does herbs. He does Rife machines, all the things I definitely didn't believe in. And I went in and he told me how I was feeling without me telling him. He gave me reasons, which in my head, I always thought, like, could it be parasites? Right? Could it be some infection? I always had this gut feeling that there was I was infected with something. Right. I couldn't figure it out, but like in my gut, I just felt like something was infecting me, And he came in and he picked out the co-infections and he picked out everything without me saying anything. And I was like, okay, well, this is a different path that makes sense to me. I tried therapies that I didn't believe in, right? I didn't believe in homeopathy. I didn't believe in herbs. My dad's a pharmacist, I didn't believe in any of that. And it helped. The Rife machine helped. The herbs helped. The homeopathy helped. The IV Flagyl helped. Like I said, things have helped all over the spectrum for me. And things haven't helped all over the spectrum. Herbs and homeopathy didn't do anything. They knew worse, right? And so it just came down to finding the right person to jumpstart me on this path. I was actually studying for my MCATs at the time because I thought I'd be a medical doctor. I was going to go to school, become a medical doctor, specialize in Lyme. And two things made me choose chiropractic. Number one is I saw Lyme doctors at the time getting their license questioned and revoked for treating people beyond the standard of care based on the CDC.
Oh, very important.
Right. And so right off the bat, you see COVID, we're not going to get to COVID, but you see how hospitals, if they don't follow recommendations, they lose their government funding. Right. So I saw this top down, Like, I want a doctor. I don't want a government agency telling me what I need to take.
Mhm.
And Lyme disease was frustrating because the government's approach was, you're better off doing nothing and keep getting sick than treating you, right? Sit home, do nothing. Like a chronic infection is going to go away or magically turn to an autoimmune disease, right? Like, it bothers me when people tell me that Lyme disease doesn't exist because after 2 or 4 weeks, now it's chronic Lyme, it's autoimmune. Like, what other infection does that? Like, what other infections do you not treat that automatically magically disappears and turns
Right.
into a chronic autoimmune? Like, we knew from Alan Steele that it's not a rheumatoid autoimmune disorder, right? Like, Willy Burgdorferi proved that. And Willy Burgdorferi was a spirochete expert through the government. And Willy Burgdorferi has a quote saying, "The worst thing I ever did in my life was find the spirochete." Because he got completely killed with that stuff. They wanted to be an autoimmune disorder, and they still want to be an autoimmune disorder. We can get into the history of Lyme. We cannot. It's controversial, right? When you look at the history of it. But having said that, so that was one thing I said, you know what? These are amazing doctors, and they're getting dinged by the government, and they could lose their license for trying to treat people to get them better. Like, what kind of evidence-based care is that removes all clinical experience, right? And then number 2 was a chiropractor helped me more. I said, so I actually stopped studying for my MCATs, and I went to the guys, I want to be a chiropractor. This was a different approach that gave me a wider scope of ways I could help people.
Mhm.
And I went to chiropractic school saying, I want to learn every way to help somebody outside drugs and surgery. Not that drugs and surgery aren't great and serve their purpose, but I had a chronic infection, and that wasn't the answer for me, right? And I know 1 out of 2 people have a chronic disease right now, if not more at this point. And so drugs and surgery are super important, have their place, but what do you do with somebody who's got stealth infections? What do you do with someone who's chronically ill? What do you do with someone who's got an autoimmune disorder? Or if you have one autoimmune disorder, there's a chance you've got more than one, right? And so what do you do with somebody who needs more or different type of care? And so I went into chiropractic school at about age 28, 29, having spent about 9-10 years studying health. I was actually consulting with people doing functional medicine before I got into chiropractic school. So when I got into chiro school, I was very motivated, right? I was a basketball player. Not that I didn't do well in school, but I didn't care. I was going to be a professional basketball player. I was going to go overseas, if not the NBA, go make money, come back, start a business. Like, why am I learning this stuff? And then when I went back to school later in life, my late 20s, not only was I a little more mature, but I was very motivated to figure this out. So I was at seminars every weekend. And like I said, my mentality was, what can I do to help people besides drugs and surgery? Right. And so it was everything under the sun. I went to chiro school being like, I'm going to be a Lyme doctor.
Mhm.
And I'm going to treat Lyme. And, that's not what I am right now. So obviously I see Lyme patients. I do treat Lyme patients, but my thought was I was going to have a Lyme specific clinic in the future. As we add more people, we might shift back into doing more infusions, and we might shift back into that more functional medicine realm.
Uh-huh.
But while I was in school, there was a doctor named Dr. Carrick, who you mentioned, who's a world expert on brain health and brain plasticity, and how to create changes in brain function which correlate to improvements in behavior and symptoms. And in 2014, there was a very famous hockey player named Sidney Crosby, who was 24 years old, who was the #1 hockey player in the world. And what happened was he had a concussion. He was at Pittsburgh Penguins. The University of Pittsburgh is seen as the gold standard of concussion care. For 9 months, they couldn't get him better. And at age 24, they told him he had to retire. The #1 player in the world, 24 years old, said he couldn't leave the dark room without symptoms. And so what do they do for 9 months? Especially back then, this is probably 2010, stay in a dark room. And then come out. If you get your symptoms, go back in the dark room, right? And that was his care. And after 9 months, they said, you can't get out of a dark room, you got to retire, right? 3 days with Dr. Carrick, he was symptom-free. 5 days, he's back on the ice.
Oh my gosh.
No drugs, no surgery, no supplementation, no dietary changes. All very specific exercises for the brain to improve brain function.
So, and I should mention that you are now, working at the Neurologic Wellness Institute, and that's in Florida, correct?
Correct. We have 2 in Illinois. So we have 1 in downtown Chicago, We have one in the west suburbs of Chicago, about 45 minutes west in a place called Wooddale. And then we're opening up May 2nd in Boca Raton.
Amazing. And you all follow the same protocol, essentially.
Essentially, the problem with the brain is there's no protocol, right? And so I'm the head of training. I'm one of the owners. And so our job is to train our doctors on appropriate diagnosis, train them on appropriate management, but there's no protocol. So it's up to our doctors to be able to use their brains and really figure out for this patient, these are the things that make the most sense and work the best. And just a little bit of a trial and error, which is why insurance reimbursement is sometimes difficult because it's not so black and white.
And just to sort of digress a little bit, can you treat patients that are pretty sure they have Lyme disease or something of that nature without a bona fide test and clarification of that?
That's a good
because
question.
Testing is just so expensive right now. And I have a lot of people ask me, I have all the symptoms, I've been cleared of everything else. What do I do? I can't afford, $2,000-$3,000 in testing. And my gut reaction is always just, treat the symptoms, but you may have a different approach. So how would you view that?
Unless the research changed since I last looked at it, Lyme disease is a clinical diagnosis, meaning that you can't diagnose it off a test. A test can help you be more positive as far as that you have it, or might give you some more information. Mm-hmm. But at the end of the day, it's all history, it's all presentation, and it's all testing's part of it. But the reality is, like, if you present symptomatically with your history, like you could have Lyme disease, then you could still be treated for Lyme disease if the doctor has experience and believes that that's the most appropriate thing for you. And I tell people all the time that the testing is not perfect, right? We like to test, I use IGeneX because it's been around a long time, but there's other tests out there that are good, and I have no loyalty to one test, but that's the one that just has been around the longest, so I like it. And I tell people I would like to test for co-infections with Lyme, because when you look at tick-borne infections, it's very rare just to have Borrelia, right? It's very rare since 1940, let's say, to just have a spirochete, and not have some form of co-infection with it. And so because the testing is not great, I like to do multiple tests, but could be $1,500, $2,000, right? And so that's why I tell people you have options. Clinically, you present as if you could have Lyme disease. We have a few options. A, you can run some tests. It's not cheap, it's not perfect, but it can give us more information to make you more comfortable that this is worth treating, because treating is not easy, right? And so it might just peace of mind, psychology might give you more peace of mind to know this is definitely what's going on. I came back positive, so I'm going to make both the time, the emotional investment, the time investment, the money investment for the treatment. Because I always tell people, more people go broke treating Lyme disease and get cured, right? Like more people are going to go broke trying to treat Lyme disease and probably will get better, because it's so many reasons, right? We can get into. And so I'm very sensitive to people's time and money. And at the end of the day, it's like, you got to try it out. So sometimes I'll tell people we do the testing, let's wait. Sometimes I'll tell people we could start treating, let's do the testing and we'll see. Or let's just, forget about the testing, let's start treating and see how you feel.
So it's basically an individual basis. And are there different treatments for different types of strains of tick-borne infection?
That's a good question. There's only so much we know, right? And so what I like to do is I like to use, especially when it comes to more herbal aspect, I like to use more broad-based microbials, so I like to use things that are not just specific to one thing. Mm-hmm. So like would different strains of Lyme be treated differently? Maybe. But I would say the bigger question is, how good is Lyme at evading your treatments? Whether it's antibody that can go into like a bleb or a cyst form, or whether it's an herb, how are you going to adapt to that? How are you going to adapt to these things might be in biofilms? I don't know if it's the best thing to break up biofilms. A lot of good bacteria in biofilms, so how do you address that aspect? And so I'm not so concerned as far as which strain per se from a nutritional standpoint. Now medications are different because it's one chemical. When you start looking at these supplements, they're a little more broad-based. So I look at it more as like a broad base. I want to do things for all the strands I can, all different parasites, all different viruses. So, and then I might rotate saying, I'm going to focus now on Babesia because you present more with Babesia. And I won't give you as many things for Borrelia or for, Bartonella, and see how you feel, and just do a little bit of a trial and error versus, because I'm very familiar and I'm very sensitive to Herxheimer reactions. And so I'm not the one you want. If you want to get better for Lyme and you want it tomorrow, I'm not the right person, right? That's not me. I mean, there's clinics out there do intensive Lyme. They seem to do good work, and I'm the guy that says, let's start low and slow. Let's slowly build it up so you don't have much of a Herxheimer reaction. Let's figure out what responds best to you. And then based on that, let's look at function, because sometimes, we don't know, a lot of our patients, how much of their symptoms are from Lyme, how much are from co-infections, how many are from metals, how much is from emotional trauma, past history, how much, that's the problem with me with Lyme, is it's so gray to correlate the infection with the presentation. It can be, right? But it becomes really difficult sometimes to put your finger on and say, that's because of a spirochete or that's because of a parasite. And so it becomes very, very difficult to make substantial claims definitively. And that's what part of my frustration, of part of why I stopped treating as much Lyme as I did, was I'm very emotionally attached to it. I've lived it. I want to help people, and it's very gray, and it's a difficult thing to deal with. And which is why, if I'm probably going to do it again, I'm going to bring in a specialist with a scope that's like a medical doctor that has the ability to do things with infusions beyond what I can do. I've known a lot of things out there, and it doesn't mean what I'm doing is wrong or bad, but everyone's so different that I'd like to have a little more of an arsenal to help people versus I think, and again, I don't want to offend anybody, but I'm not another Myers cocktail clinic. I'm not going to do that, right? You're not going to come in and get glutathione. I've seen too many people in the functional medicine world disrespect the importance of the infection and try to treat every metabolic pathway, and people are walking out with thousands of dollars of supplements, and there's not one antimicrobial in there. All the time, I see that. Most of my Lyme patients come in, thousands of dollars of supplements, not one antimicrobial, but they're supporting every metabolic pathway, which reality is, you look at a lot of people, I'm a chiropractor. Chiropractors sometimes can be a little anti-medicine, a little more natural. But to me, it's they'll bash the pharmaceutical company for having influence on medical education, but then go to a nutritional supplement company and take a seminar from them and think it's better or different, right? When this nutritional company has every same bias as a pharmaceutical company, and the pathways they're using to sell their supplements are the same pathways the medical companies are using to sell their drugs. And it's the same thing. And, and it's not always gluten. Not saying gluten's bad and or good, but just because you have an illness doesn't mean gluten's the thing that causes everything.
Sure.
Right? And so too many people just make blanket statements and claims. And I just think it's a lot more complicated, which makes it difficult.
Very, very specific stuff. And, it takes a doctor just like yourself who's been through it, who can really go slowly and unpeel all the layers. Are there any strains of tick-borne illness that present more heavily in neurological symptoms than others? Or do they all eventually end up hurting us neurologically?
I would say that, there might be certain strains that might be a little more susceptible, but I tend to think that a spirochete's like a kind of screw, right? And it's like a corkscrew, and it's not going to move very well in blood or in fluid. It wants to be in tissue. And so I tend to think in general, it likes to go in the heart. It likes to go in the nervous system. It goes to different areas. And I also think it's, look at COVID as an example. It went to the weakest area for people. And I think infections, that's kind of what they do. Obviously, there's a germ theory, which I'm not saying is inaccurate, it's true, but there's also an environmental theory, right? And they're both true. And so at the end of the day, wherever your weakness will be is where these areas will attack.
Okay.
And I think, the nervous system is an area in general that's getting weaker. We've got increased neurodevelopmental disorders, increased neurotraumatic disorders, increased neurodegenerative disorders. And so I think, who knows why, right? But society in general, our nervous system is more vulnerable. And it becomes very difficult when the infections get into the brain, both from the direct impact and also the secondary impact of inflammation and cytokines. And these things can cause really disasters that just don't make sense because they're not presenting in a textbook. And so a lot of Lyme patients come in and there's no book to explain what's going on with them. But what they're experiencing is extremely real.
I had my own personal turnaround the moment I went to a chiropractor. So for 6 years, I was batted around between conventional doctors, specialists. I mean, nobody could give me an answer. Nobody once suggested I test for Lyme. I went to 2 neurologists, and one of which basically begrudgingly, was like, listen, I only do the Western blot and ELISA test. And I'm not certain that it does any good anyway with this testing. It's just hard to know. So he shot it down altogether. And the other one put me on gabapentin for a while. So whereas, initially when I was having so many neurological issues, the gabapentin did help, but I knew it was not the root cause of my issue. After suffering, and I do say suffering, for 6 years, and wound up at the premier LA, fibromyalgia doctor, blah, 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 who's telling me that you don't have fibro. And I said, okay, I knew that, but how do I go from like a spin class 4 times a week to not being able to walk? I just didn't understand it. Yeah. But I finally remembered, a lot of people had referred me to this chiropractor in town, and I just was so stubborn, just like yourself, in realizing that something like that could be effective in my treatment. By the time I got to him, I laid down on the table. It took me about 5 solid minutes to even be able to lay down. I was in so much acute pain. And I laid on my stomach, and I remember just the tears were just coming off my face because I was in so much pain. He couldn't treat me that day, obviously, because I was too inflamed, but he put me on the right path, and, started out with just some basic commands of stop massage, stop trying to stretch, stop hot tubs, stop all this sort of stimulation to my nerves, and just stop it for a while because we need it to calm down before we move forward. So that was a huge turning point in my own journey. And I'll forever be grateful to him for doing that. So let's go back to your options for treatments at your centers, because I know a lot of people are listening and they want to know specifically what you offer, and specifically for neurological symptoms pertaining to a chronic illness such as Lyme.
For sure. And so first off, we do nutritional guidance, right? And so nutrition is important, but that's not what we focus on, because a lot of people focus on that, right? We do have supplements, and we do functional medicine, right? And so we do have a lot of antimicrobials from very good companies, and, et cetera. And we do that, but that's not what we specialize in, because a lot of people specialize in that too. And so what we really figured out, and based on my training, is our clinic has really found a niche in brain plasticity and improving brain function where there's really not a better option, right? And so Lyme is a little tricky because, it's a chronic infection that impacts the nervous system, where like a concussion is an easier explanation for what we do because it's an injury. And we're the best option right now, as far as not just us specifically, but what we do, like other people also, that type of therapy as far as exercises to improve brain connections. Where Lyme is tricky is because let's say you have Lyme disease and let's say you cure it, right? Whether it's fully gone, whether it's still there, but your immune system's managing it, we don't know, right? But let's say your symptoms are extremely better. But if there was damage to areas of the brain, it doesn't mean the brain is then just going to come back and click and be back working. You might compensate and you might feel better, but at times you might be stressed or not get enough sleep, or things like that, too much activity around. You might know these are the times my symptoms come back. And that might not be because the symptoms come back. That might be because you're compensating and the areas of the brain never got fixed. Area B is doing the work for area A. And when that gets tired, overloaded, area A can't work still, And so a lot of what we do with our patients, but Lyme especially, is we measure brain function, whether it's through cognition, whether it's through QEEG brainwaves, whether it's through eye movements, whether it's through balance, whether it's through cranial nerve or full exams. And we try to map out areas of your brain that are working well and areas of your brain that are not working as well. When you look at Lyme disease from a neurological perspective, what we see with a lot of Lyme disease is called dysautonomia, right? We see a lot of problems in the autonomic system.
Mhm.
and it's no different than chronic fatigue syndrome. We see a lot of dysautonomia and chronic fatigue, and fibromyalgia. These are the underlying relations where all these things have in common. A lot of times it's the dysautonomia, or it's the problem with your autonomic system that your blood flow gets dysregulated, and it could cause dizziness, it could cause lightheadedness, it could cause chronic pain, it could cause walking and standing issues. So it could cause a lot of problems, and it becomes tricky. And so what we do at our clinic, besides nutritional and supplements, is we start trying to strengthen the areas of the brain that help control your autonomic system. And so we do different therapies as far as, could be as simple as eye exercises, it could be a certain technology with different lasers and light. We've got different like PMF devices like the Beamer to help improve blood flow. Just to break it down, it's very simple. Like, you have area of the brain A. If you know what stimulation from the environment eventually ends in area A, you can use that as a therapy. Or to say it differently, we know the brain is electric, and more technology is coming out to interact with the brain with energy, right? Energy medicine, although in the past, energy medicine was like a kind of like an esoteric topic, you know what I mean?
Yeah.
Energy medicine is becoming very real in neurology with transcranial magnetic stimulation, transcranial direct current stimulation, alternating current stimulation, photobiomodulation with light therapy. And so energy medicine is becoming very, very real in real-time medicine. It's not, it's more than just, Rife machines and lasers and light and auras and chakras, et cetera. And so what we're seeing now is when you, for example, I'm looking at the computer screen. There's receptors in the back of my eye that are being stimulated, and they transduce into an electrical stimulation. And that electrical stimulation goes through my peripheral nerve, or in my eye, part of the central nervous system, which is a little different, but it goes through the nerve into the brain and stimulates the brain with electricity. And so what we try to do is understand the pathways that we can use to strengthen connections in the brain to improve function. So if we just go through really quick, your nerves in your head, your cranial nerve 1 is smell. And so if you want to, COVID, for example, a lot of people lost smell, or if smell is associated sometimes with memory. And so we want to stimulate areas closer to memory. Also smell, you lose your smell, you're probably gonna lose taste, because smell and taste are very closely related and go to the same area. And so we want to stimulate those areas in the brain. We could do different aromatherapies, and it's going to be different with like a peppermint smell that's a little more minty or a little more pungent versus like a sweet orange smell, or sweet smells. And so we could do different types of smells to stimulate the brain. Your cranial nerve 2 is your vision. We can do different light therapy with different color lights. We could do strobe lights to flash different stimulation, and we can do things with your vision. You look at cranial nerves 3, 4, 6, they're eye movements. And so we could do very specific eye movements, horizontal eye movements. This is going to be a generalization, it's true, but it's so general, it's not true, if that makes sense.
Yeah.
So horizontal eye movements are a little more associated with like your parasympathetic centers. Your vertical eye movements are a little more associated with your sympathetic centers. So true, but not true, right? And generally it's clinically accurate, but it's more complicated than that. So we can do different eye movements to help stimulate the autonomic system and stimulate parts of the brain. You look at cranial nerve 5 that I skipped because it went 3, 4, 6. That's your trigeminal system. We do a lot of electric stimulation to the face. Classically, you do that with like headaches and migraines, which you can do, and you see these things over this little orbital area. There's a nerve that goes right that seems to help. And so we do a lot of stimulation with electric stimulation to the face. You see like actors, there's new therapies like face yoga. You mentioned LA, it's big in LA, all the face yoga.
The face yoga. Can't forget that.
Right. But that has a huge brain consequence because those muscles have a lot of feedback into the brain, and so there's a consequence to the brain. When you look at cranial nerve 7, again, that's the facial nerve. Those are the muscles of the face, but you also have some taste in your tongue. You have some areas in your ear for sensation. And then you get to 8, and 8's interesting for Lyme because that's your nerve from your inner ear. And so that could be impacted from viruses or certain infections that cause vertigo and cause dizziness. It's also your hearing. And so that could help cause tinnitus or ringing in the ears. And then you look at 9 and 10, those are more a little associated with a few things, but we look at more as like the back of your throat, and those are lower down. That could be more associated with kind of your vagus nerve system, cranial nerve 10, and that parasympathetic system. You got 11, which is kind of the muscles in your neck, which, we could do massage, electric stimulation there. And then 12 is your tongue. We do electric stimulation on your tongue. It's a really powerful input. There's actually, you could look at non-invasive neuromodulation of the tongue, and there's a lot of research looking at electric stimulation of the tongue to impact the brain. If you look at concussion, there's a company called the PONS unit, and their whole unit is a tongue stimulator to improve balance and help with certain concussion symptoms. And so right off the bat, just from a basic level, what we try doing is therapies with an understanding of where they're going to target in the brain. And so you might only do therapies on the left side of your body because we want to target more the right side of your brain, or vice versa. We might do therapies on the right side of your body, target the left side of your brain. We might do therapies in your legs to target more of the middle parts of your brain. You might do therapies on your arms to go a little more lateral outside, you know? And so it really comes down to, can we strengthen areas of the brain that are healthy? Lyme disease is great because some people, they'll come in with Lyme disease, or there's one thing I'll tell you is I tried not missing it. Whether I treat it or not, I'm very adamant to not miss it. Right? I'm not going to miss a lot. I might, right? We're all human.
Right.
But like, if I miss a Lyme diagnosis, I have a tough time, right? And I haven't, not that I know of, but I'm very good at asking the right questions, and I lived it.
Yeah.
So if you walk in my clinic, I can sniff it out. And it doesn't mean you have it, but I'm not going to miss asking a test for it or to address it, you know? And so some people with Lyme disease, especially, they're not even in the position yet to do some of these therapies. It's too much, right? And so you look at some of there, it's too much. And I might say, look, we're going to start here, or I might refer you to someone who just does this, whether you want to work with me or not, or we'll refer out, and we see people who do both, and then come back and let's just reassess. And until you're a little more stable, usually it's your autonomic system because you have trouble standing up, you're in a wheelchair, you're lightheaded, you're dizzy, you're fatigued, you're chronic pain. You know, these are things, my therapy, I always tell people, you should never get worse from my therapy. You should only get better. Like this isn't one of those things where you're gonna get worse before you get better. Like that's not what we do. You know, if we were getting worse in our therapy, we're either doing it too much or it's inappropriate.
I think it's important what you said about pacing them along and starting out slow. That was also key for me, that, you know, a lot of times to walk into your clinic, obviously you're not going to throw all of this at one person at one time. You're going to just kind of take everything in a methodical way, because neurologically our bodies are just on such stimulation overload. And I would imagine that's a big part of how you pace yourself. I'm also wondering, how do you know, is there a specific test that you do or scan that actually pinpoints the areas of the brain that are compromised?
It'd be beautiful if there was, right?
Yeah.
There's new technology that's getting better. Look, we don't have an fMRI machine. We don't have a SPECT scan. Both very, very cool technology. You can diagnose off it. Like, for example, I actually got insurance to cover my Lyme treatment because of a SPECT scan. I got a SPECT scan at University of Columbia in New York. They showed a polka dot pattern of blood flow decreases that is seen with Lyme disease. And that's how insurance covered my treatment, believe it or not. You know, by seeing the SPECT scan. Yeah, I don't know if they probably don't do it anymore. They probably cut that off.
Yeah, well, that would have been too easy.
I mean, yeah, but that's how I got covered. So these are things where you can get more information, how the brain functions. When it comes to the brain, there's no one test. So there's imaging, MRIs and CTs that could show brain structures. But unless you've really got some degeneration, you know, or vascular issues, it's really hard for a Lyme patient. It's hard for that to be abnormal.
Yeah.
Then look at fMRIs, SPECT scans, and we use what's called QEEG, looking at brainwaves. And those give you some more windows to look at different glucose, look at oxygen, look at brainwaves, and more functional windows of the brain. But you really can't diagnose Lyme off it per se, but you could say this pattern looks like this, or when you do this cognitive task, this area of the brain doesn't light up. Or, you know, when you're at rest, you have too much beta activity, right? And so you can start looking at patterns and say, this is probably why you don't have your symptoms, right? I used to work in a clinic in Atlanta, and the Amen clinic was there, right? And I won't get detail in the Amen clinic. I like Dr. Amen, but, you know, this is before he even had his supplements. You know, this is early on. Every once in a while, we refer there to get his SPECT scan just to say, what are we missing, right? Is there an area of the brain that's not activated that we're missing? You know, so every once in a while, we would do that. But from our tests, I always tell people, if the test doesn't change my treatment, then why spend the time or money? Right? Why do? If it's not going to change, like you mentioned, like if I'm going to treat you with the same way with Lyme, whether I test you for it or not, we'll talk about it. I'll test you for it. but it comes down to your personal decision. If I think I want the test, I'm not convinced you have Lyme, I'll tell you, I'm not convinced. I think we should test because I'm not convinced. But if I really think clinically it makes sense, you've seen a tick on you, you got sick right after that, why do you don't need the test?
Right.
No. Like clinically, there's no research that says that you need a test to diagnose Lyme. If you come in, and we've seen people from Germany, from all over the place that said, I got bit in Germany, then I went and got home and got bit in Michigan. And ever since then, I've never been the same.
Yeah.
Okay. Whether it's a spirochete, whether it's a parasite, whether it's a combination, at that point, the testing to me is, I won't say it's irrelevant because it's not. It could be very confirmatory, but it doesn't mean you need to be tested to be treated. There's no evidence for that.
I love Michael J. Fox's quote, which says, the people living with the condition are the experts. And it's really true because we can tell you exactly what's going on in our body. And my story is not the same as yours or, anybody else's. So it takes a really great doctor to listen.
One of the questions I tell people, I think people think I'm crazy. Like I teach a lot, right? I have a lot of observations and people observe and kind of come do shadowing.
Yeah.
And I'll ask, especially with Lyme type patients, I'll ask people when they're chronically ill and I'll say, in your gut, what do you think is going on? What's your gut feeling? It doesn't mean I'm listening to them or believing them. Yeah, it does, but people generally, like I said, my experience was I kind of had an idea what was going on. I couldn't articulate it. I wasn't educated enough to understand it, but I was like, there's nothing makes sense. There must be some type of infection. And everyone said it's too simplistic, right? It's too simplistic. It doesn't work that way. Well, it did.
Right.
And so I listen to people. It doesn't mean I automatically agree with them, right? But you've got to listen to people and understand where they're coming from. Mm-hmm. And a lot of people are on the right track, just inherently understanding their body. And so I think, that's to your point, you've got to listen to where people are at and understand, my job is not to tell you to do anything. I tell my patients all the time, I'm not going to tell you to do anything. My job is to educate you, give you my advice, give you what I think is going to work best, but it's your life, right? It's your decision. And if you don't want to do option A, we can do option B, but I might tell you it might not be as good or it might be slower,
Mm-hmm.
but that's your choice. I think too many times the doctors can dictate care. And that puts people more submissive and it's harder to break away from that. Like how many patients have I had that won't stop their care, even though that they don't always work? This isn't working, but my doctor told me to take it. I'm going to take it.
Yeah. And so your treatments would be considered chiropractic treatments, correct? Because my insurance will pay up to 20 visits a year, 50, whatever the number is. So that also helped me a lot too. Would you consider a lot of your treatment?
It's a trick question. Insurance is tough. We're trying to do research to prove the model. So when you look at what we do, I might never adjust or do a chiropractic adjustment on a patient, right? And so when you look at reimbursements from the insurance, Illinois is different than Florida.
Yeah.
And so for our clinic as a chiropractor, I'm also licensed in physical rehabilitation. I'm not a physical therapist, but I can bill the same codes and get reimbursed maybe a little bit less. And so in Illinois, we bill physical therapy codes because we can, and we're trained to do it. And while we might not get paid a lot, it helps people, right? And so we take insurance as much as we can. That's not going to make us close our doors because we can't make enough money, right? And that comes with a little bit of a out of cover cost, just so we can make enough money to keep our doors open. But we try our best, and so we bill physical therapy codes because the chiropractic adjustment. Now we'll bill an adjustment if we do it, but the fact insurance might give me $10 for it. Right. And we see people for an hour. And so $10 for the hour is just not going to cut it. And so we do physical therapy codes. In Florida is a situation where chiropractors can't bill physical therapy codes. And so in Florida, we actually can't take insurance. We want to. I wish we could. In Illinois, we still do, even though we make significantly less money in Illinois doing it than out of pocket. We still do it because, and we can only take Blue Cross Blue Shield now because they're the only ones that pay us enough to allow us to stay operational because everyone else gives us no money, so we have a billing person that can submit out of pocket or out of network for you. But Florida, we can't, they won't pay us. And so unfortunately for Florida, we can't even do insurance. So we're straight cash in Florida, not because it was our choice. It was the only way that we can actually stay open.
Well, it's nice to know you're opening different locations, and it will give many people different choices. I really, I can appreciate all that. And hopefully Florida will reconsider something along the way. But so to everybody listening out there, if you could give them a little bit of parting advice and just an overall, last few words, what would you want to say to them?
It's not normal to be unhealthy. No matter what people tell you, it's not, right? It's not always in your head. It's not, oh, you're not making it up. That if you feel like something is really wrong with you and you've got no history of, let's say, schizophrenia or in the family, or, if you feel like, you know what, like I said, for me, I was a high level bass player, boom. For you, same thing. You felt great. You're doing all this exercise and out of nowhere. When something is significantly wrong and it impairs your ability to live a fulfilling life, there's got to be a reason. And whether we find the reason before, it's too late, there's a reason for that to happen. And too often people give up. And that give up because they get too tired. I mean, there was years I didn't go to doctors. I was so sick. I just couldn't go to another doctor office.
Yeah.
I would literally walk into the doctor. I would look around in the waiting room. I would see the staff and I would know right away the quality of the doctor, right? I would know. I've been to too many doctor's offices and I would walk in and be like, this is not the place for me. I would still try it, but it wouldn't be surprising if it was an awful experience. Or other place I'd walk in and I would just feel it, that these people are really trying to help, And so I would say is, before my son was born, I was doing a PhD in psychology. And at some point I want to finish that. And, to your point is I would say that psychology is extremely important. You are going to be your own limitation of how much better you can get. Meaning that too many of us are closed-minded based on our own personal experience. And we don't have a truth meter in our brain, right? None of us know the truth. There's no truth or false. There's a guy, I think David Hawkins, who was Force versus Power, levels of consciousness. He's really good at that. And he's wrote a lot about truth. And we have no ability to know what's true or what's not true for most people. But what we do is we have past experience. And for most people, they're entrained in a world of how the world works. And it's very difficult to get out of your own mind and out of that world that they present to you as far as how the world works. For me, it took 9 years of health issues for me to break away to say, maybe things don't work the way I've been told my whole life. Maybe the media is not being 100% honest. Maybe our government officials aren't 100% honest. Maybe there's labs that studied spirochetes and ticks. And maybe those labs happen to be the two closest points of the outbreak in Old Lyme, Connecticut and Montauk, New York, right? At some point, you have to look at this and say, regardless of what everyone's telling me, I need to control my life and I might never get better, but I need to find somebody who could at least understand where I'm coming from, have a reasonable approach to diagnose and treat. Doesn't mean it's going to work. We can't guarantee success. But I am a firm believer, as we talked about, that it's so backwards that the government would rather you stay at home and wither away than be treated. That doesn't happen with syphilis. All right, you have a spirochete with syphilis, you're not doing 2 weeks of oral antibiotics and then it's an autoimmune disease or psychological. It doesn't happen. So why is Lyme disease so different? What history makes it so different? And when you look at the history of these type of infections, it's not the best history, And so when I look at Lyme through a historical viewpoint, I'm aware of why the testing isn't great. I'm aware of why the treatment isn't great. And I try to associate myself with good doctors. ILADS is always a good group, but good people and good doctors to refer to and learn from. And because I think too often people go the mainstream route, end up with not just not feeling better, but I've seen, and I don't want to, my personal experience is I've seen a lot of chronic Lyme patients end up with lymphomas. Whether that was Lyme or not, I can't tell you. But I've seen a lot of consequences of untreated or mistreated Lyme that later on people had other health issues. And whether it's correlated or not, I don't know. But it's not normal for you to be chronically ill out of nowhere. And it's not normal for you to be chronically ill and then just sit and do nothing, right? No other disease that I can think of, the government wants you to do nothing about an infection. Or the doctors are the same. Look, like you said, the doctors are trained the way they're trained. People don't want to talk about Lyme disease. Functional medicine doctors, a lot of them, they don't want to touch Lyme patients. It's too confusing. It's too controversial. So unless you really lived it, or unless you really experienced it and you've seen these patients, you need to find someone empathetic enough to treat you like a human being and not treat you like a lab work or like, a research article.
Well, I love that. I love the neurological approach to it. I just was written to yesterday by somebody that said, I think people are surprised that if they get bit by a tick, that all of a sudden they're having neurological issues and gross motor skill issues and fine motor skill issues and cognitive issues. They think it's a bacteria, right? And so an antibiotic would naturally kill the bacteria. I don't think that people, at least in the beginning, and I didn't either, understand it just affects your brain. And so I appreciate everything that you're doing in the community and in the country and internationally to help bring wellness to people that are really, really suffering out there. Can you tell us once again how to get in touch with you?
Yep. And so my email is Dr. period or dot Traster, Traster at Neuro wellnessinstitute.com, or our website is neurologicwellnessinstitute.com.
Perfect.
And then if you have any questions, of course, feel free to email me. Like I said, we are honest, we're ethical, we see our patients. We're not a Lyme specific clinic, but we work with a lot of Lyme patients, both by ourselves and with co-managing. And we have a part in people's recovery. And at some point, maybe we'll have more of a part in Lyme disease. Like I said, if we become a little more multidisciplinary again, but right now we've created a niche to help people with neurological conditions without the use of supplements and other things if they're ready for it. And if we need the supplements, we do, but it's how can you retrain the brain to regain function off of the past Lyme disease to get back to where you want to be.
Well, I thank you so much for your work, and I'm sure that many people will come to you because of this. And I thank you also for using your past pain and suffering and your own journey to do better in the world. So thank you. And I look forward to working with you again in the future.
Absolutely. I appreciate the time. Thank you so much.